Presentation is by Dr. Vipin Rana on recurrent panuveitis in PIK3CD disorder.
Good morning, everyone. Today I shall be presenting one of the rare cases. So, activated PI3K delta syndrome is a rare genetic disorder which is characterized by the immune system dysfunction, primarily because of the affection of the T cells. And we report a challenging case of recurrent panuveitis in a young patient caused by a novel variant in a PIK3CD gene. To the best of our knowledge, this association has not been reported before. So, my patient, 15-year-old male, in 2014, while he was 8 years old, he was found to have decreased vision in both eyes on retina examination during the school retina examination, and was diagnosed to have an intermediate uveitis at center A and was started on oral steroids. However, these were stopped in 2015. In 2016, again he presented with diminution of vision at center C and was again diagnosed intermediate uveitis, again given course of oral steroids on and off. 2018 underwent tonsillectomy in May 2018, and in June 2018 was diagnosed to have Hodgkin's lymphoma mixed cellularity stage 2A. So underwent 4 cycles of chemotherapy, and oral steroids were again started along with the tablet methotrexate 7 to 8 months after the remission. So in 2019, patient again had vision deterioration and was again started on the oral steroids and tablet MMF. So underwent cataract surgeries in the both eyes, and in 2023 he reported to our center with complaints of diminution of vision in both eyes. So on presentation at our center, he was on tablet prednisolone 10 mg OD and tablet MMF 500 mg thrice daily. On examination, his anterior chamber, the cells were 2+ in both eyes, and the visual acuity was best corrected in the right eye was 6/18 parts, and in the left eye it was 69 parts. And in the fundus examination, we can see the multiple dense vitreous membrane were present in both the eyes. So FFA showed in the right eye there was a diffuse capillary leak along with cystoid macular edema in the left eye. So we started, patient was started on this tablet MMF, and tablet oral steroids was high. But on tapering the dose, in April, patient again presented with the recurrence. Vision deteriorated to 6/36, and the right and left 6/9 parts. And again, on FFA had capillary leak in right as well as the left eye, with presence of the petalloid appearance suggestive of the cystoid macular edema. So the plan was either to change immunosuppressive agent, add another immunosuppression, or start biologics. And in the meantime, the consultation of the pediatric rheumatologist was taken. And for the timing, the patient was given injection Ozurdex in the right eye. And post Ozurdex, vision improved to 6/9, and we can see the significant decrease in the vitritis. So the whole exome sequencing was sent, which showed in exon 8 there was PIK3CD mutation, and which was further confirmed on the Sanger sequencing. And OMIM phenotype described for the variant was autosomal dominant immunodeficiency 14A with lymphoproliferation. And immunological profile was also suggestive of the same, with increase in the IgA and IgGM. So the final diagnosis was APDS with bilateral panuveitis with Hodgkin lymphoma, and patient was continued on the same treatment, and further we added the subcutaneous methotrexate after the consultation with the pediatric rheumatologist, and the parents were counseled for the hematopoietic stem cell transplant. So to conclude, a novel PIK3CD mutation expands the spectrum of known mutations and highlights the need to consider genetic causes in patients with recurrent treatment-resistant uveitis and systemic infections. And it is imperative that the patient and family members are counseled for the condition and its implications for the patients as well as the family members, and it needs a multidisciplinary approach. So take-home message is: young patient, recurrent infections, not responding to the treatment as expected. Start thinking out of the box. These are my acknowledgements: Dr. Mohit Dogra, Dr. Ankush Jindal, PGI Chandigarh, Dr. Vamshi Krishna, Lal Path Lab, and my resident, Dr. Nandan Tripathi. Thank you so much.
Thank you, Dr. Rana. Excellent case that you've discussed. One thing I would also like to highlight is on the angio, on the fluorescent angiography, there was a large area of ischemia also there. So apart from the Ozurdex that you had injected for the macular edema, it's very likely that this patient is